Well, thanks again for coming to the third SAFE session today. My name is Erin Stadler, and I am an M1 student here at the University of Wisconsin School of Medicine and Public Health, and I'm originally from Fond du Lac, Wisconsin. I'm one of the co-leaders here at SMPH, along with Rachel and Kyle, who are also helping to co-host this session. And our chapter is super excited to be kind of jointly hosting with SAFE the series on secure firearm storage, education, and policy. So if you weren't able to attend the first few sessions, no big deal. We're going to drop a link in the chat so you can watch those kind of on your own time if you're interested. And by watching the previous sessions and then attending later sessions in the series, we hope that you'll be able to kind of think more critically and independently about secure storage laws in your home state and form your own opinions on the subject and be able to kind of better articulate, should my state secure storage laws be changed? If so, why? And how can I go about aiding in that effort? So the series overall will just help you to become more knowledgeable and effective advocates for evidence-based secure firearm storage, as well as child access prevention strategies. So now I'm going to hand it over to Kyle.
Hi, everyone. My name is Kyle Shoger. I'm also an M1 at the University of Wisconsin, and I'm from Lake Geneva, Wisconsin originally. So for those of you who are new to SAFE, SAFE is an acronym which stands for Scrubs Addressing the Firearm Epidemic. It is a nonprofit organization made up of U.S. medical students, physicians, researchers, nurses, and other healthcare professionals who are dedicated to eliminating the firearm violence epidemic through research, education, and evidence-based policy. In today's session, our esteemed guests will provide coaching on tone, the power of storytelling and anecdotes, and perseverance as physicians and medical students step into the advocacy roles into communicating with our elected officials. That flows into the importance of relationship building with legislative aides, and then we'll hear about a day of action in Wisconsin and how to host something similar in your state. Healthcare professionals are already natural advocates for their patients, so the concern for their patient safety translates into powerful advocacy. And I'll have Rachel introduce herself as well.
Hi, everyone. I'm Rachel Bear. I'm from Merrill, Wisconsin, and I'm also a first-year medical student at UWSMP with Erin and Kyle. So as Erin mentioned, this is a six-part series. It originally was intended for Wisconsin, but it has grown to include individuals who hope to do similar series in their own states. So the overall goal is to become better healthcare professionals, to be knowledgeable and effective advocates for evidence-based secure firearm storage and child access prevention policies. I am hopeful that SAFE will help to educate current and future clinicians on the importance of sharing their voices on firearm injury prevention, and we can improve policies that will ultimately reduce injury and death by firearms for our community members. So I'd like everyone to keep themselves on mute throughout the presentation to eliminate that background noise. But please put in the chat, what state you're calling from today and introduce yourselves. And I'll pass it back over to Erin.
So first, we're going to hear from Dr. Brian H. Williams, who's an Air Force veteran, trauma surgeon, former congressional health policy advisor, and a recent candidate for U.S. Congress in Dallas. As a frontline clinician, medical educator, and a best-selling author, he's a nationally recognized leader in the space, using policy to prevent gun violence, create health equity, and promote racial justice. He's a member of SAFE's National Board of Directors and will provide coaching on tone, power of storytelling, and anecdotes and perseverance. We're honored to be able to hear from him as physicians and medical students step into the advocacy role and into communicating with our elected officials.
And then after Dr. Williams finishes his portion of today's event, we'll hear from two firearm injury prevention professionals. First, Sean Holihan, the state legislative director at Giffords, which is a national organization focused on research and advocacy regarding gun violence prevention, followed by Nick Matuszewski, the associate executive director of WAVE, Wisconsin Anti-Violence Effort, a state-based nonprofit organization that recently formed a healthcare coalition for Wisconsin healthcare providers. We are also encouraging those of you in Wisconsin to attend a day of action on May 20th, hosted by WAVE at the Wisconsin Capitol. This is an event solely focused on gun violence prevention happening on May 20th. There's a link in the chat now for you to be able to register. What you learned today will help advocate either in Wisconsin on the May 20th event or in your own state on any advocacy day or day of action. We are thrilled that WAVE is putting on this event. It's a great opportunity to practice advocacy skills with state legislatures and their aides.
And now for the next 20 minutes or so, we will hear from Dr. Williams. His reasons for doing this work today are compelling. So I'll ask that he introduces himself and how he became a physician who is focused on firearm injury prevention as he talks about how he became an advocacy and a policy author. So please feel free to put any questions in the chat. We'll be answering them towards the later part of this event. And now I'll pass the baton to Dr. Williams. Thank you for being here today, Dr. Williams.
Thank you for having me. And I'm really excited for this session because I really believe that the intersection of health policy and clinicians like us is extremely important if we're going to make any progress in healthcare in this country, but also specifically for gun violence. And to have this sort of opportunity at this stage as a medical student was something I didn't have. And I'm a bit envious, but also honored to be able to contribute to the session today. Now, I know this is a Wisconsin-based event, so you're probably wondering, like, why is this guy from Dallas, Texas, talking to us? And I will explain that. And we're talking about secure firearm storage today, but I will also give you some actionable tips that you can use starting today for a broad number of healthcare issues if you want to engage your policymakers and inspire them to action. But how did I become involved as an advocate? For the longest time in my career, I separated my role as a doctor and a trauma surgeon from that of advocacy and social activism. And it took a gun mass shooting tragedy to kind of bump me out of that space. About 9 years ago, there was a mass shooting in the summer here in Dallas, Texas, which became the largest loss of life for US law enforcement since 9/11. And I was a trauma surgeon on call that night. And a little bit of the background about this is that there was a racial justice protest in downtown Dallas, attended by about 500 protesters. And at the event, Dallas PD was providing security for the event, and there was a lone sniper there, a Black Army veteran, who was targeting police officers because there had been a series of officer-involved fatal shootings of Black men that year. So his means of protest was to target police officers, 7 of which were brought to the hospital where I was on call that night. And unfortunately, our team could not save 3 of those officers. And I still think about this day every day. It's one of those transformative events where afterwards I thought, what am I doing to help end this epidemic of gun violence? What am I doing to kind of promote healing at a national level beyond seeing my patients in the hospital? And that put me on this path to get more involved in advocacy and policy. If you do know me, you probably have heard of this this press conference that was given a few days after the shooting. And it was then that I, for the first time, verbalized a lot of things I was thinking about, that we need to end this epidemic of gun violence, that we need to promote racial justice, that we need to promote trust within our communities. And this clip went viral. You can look it up online after this talk. But out of this 1-hour press conference, those 2 minutes resonated. And from that point on, I mean, even if I wanted to go back into my shell and hide, it was not possible because it just became this event that people continue to talk about. So from there, I started over the next couple of years shifting more and more from clinical work to advocacy work, to the point where I actually left my clinical practice and went to DC and worked full-time as a health policy advisor. And during that time, I had the opportunity to serve for Senator Chris Murphy and work on the Bipartisan Safer Communities Act, which was the most significant gun safety bill passed in a generation. Following that, as mentioned, I ran for Congress, supported by healthcare groups. Giffords, Sean, supported my campaign as well. So thank you for that. And why am I telling you all this? Because if you want to be effective advocates for gun violence prevention, what I'm sharing with you is not just what I read in the books or what I heard at a lecture. I'm talking to you as a fellow clinician who has also been on the side of trying to convince policymakers to create policy that will keep us safe from gun violence, but also as an advisor, being on the other side of the table, listening to hundreds of people come in and pitch their policy ideas. So I'm going to give you this global perspective with that experience of how you can actually use that to your advantage. And if you don't remember anything from this talk today, just remember this, okay? Statistics, you must bring those so that they will believe you. The staffers, the elected members of Congress or state legislature or city council, bring the numbers so that they believe you, but it's the stories that matter. It's the stories that get them to care. It's the stories that they will remember. And you, as healthcare workers, have stories that nobody else has, right? You can talk to them what it's like to care for kids and young adults who have been victims of gun violence. Talk what it's like to talk to the survivors, their family members, what it's like to deal with this in the ED or the OR. Those are stories that you have that no one else can tell from that first person perspective. And even better, if you can bring one of your patients, the survivors, with you to these meetings, that is a bonus. But also, as a highly educated doctor to be, you understand how to review evidence. You understand how to take that evidence and translate it into words that non-clinicians can understand. So those are your superpowers. Bring the stats and bring the stories. Remember that, and you will be superpowered. But here's some more important information. Let me look at that yet, okay? I don't want you to get distracted. Let's just talk for a second. Let's think about perspective and perception, okay? When you are advocating for gun safety prevention or any other issue, when you're talking to staffers and policymakers and elected officials, they see the world a little bit differently than you do, okay? We, especially in academic medicine, we're motivated to publish or perish. We become very expert in a specific area, like we're a mile deep. You're a subject matter expert. Peer review is important to us. Teaching, getting the grants. If you're on the Hill, they're looking at, okay, what does the press say about this issue? They're covering so many different issues that they're a mile wide and an inch deep on these things. So when you come in, you got to come in, hit your points, bring the stats, bring the stories, and break through all of that noise. You have to learn a lot of issues pretty quickly. Public opinion matters. So the point of all this is, and I'll share these slides with Allison so you can have them afterwards, is that if you're taking your issue, just like we're talking about gun safety prevention, secure firearm storage, you're bringing your perspective on this, but you have to put this in a language that also will resonate with them and understand that they're seeing this one issue amidst a mountain of other issues and looking at things a little bit differently than you may be doing that, okay? Again, on this perception and perspective issue, we like the scientific method, right? We go through a very rigorous process to decide what information is of value and worthy of being believed and shared. We review the literature, we have our methods, we analyze our data. Policymakers, politicians, they look at things a little bit differently. Like, what is the issue? What does the current law say? What has been their individual positions on this issue? What is their party's positions? What are the different key holders or stakeholders have on this issue? So think about that. When you're talking to them or presenting or writing them, put yourself in their shoes, in their mindset. And that's how you can become a more effective advocate. So there are a number of things you can do. I get asked this question a lot, like, what can I do as a medical student or as a resident, or nurse, anybody? What can you do? There are so many things. If you identify the issue that matters to you, one that keeps you awake at night, one that you cannot stop thinking about, one that you're always reading about, just hone in on that and then decide, how do you want to get that message out? And understand, we're talking about Wisconsin, and I'm talking a lot about federal stuff, but federal, state, and local policy, they're all interconnected. So do not feel that you have to fly out to DC and meet with your member of Congress in DC. You can make a huge difference right there in your own city or county. So joining your professional organizations, contacting your elected officials, whether locally, state, nationally, grassroots campaign. Advocacy organizations such as SAFE are important to be involved in and to get the message out. I'm a personal fan of writing op-eds and letters to the editor because we are so used to sending our stuff in a peer review to get whatever journal that is behind this firewall and in language that the average person cannot understand. So if you write an article that's published in the New England Journal of Medicine, if you take that and repurpose that in a 600-page op-ed that's published in your local paper or in USA Today or the New York Times, you will reach so many more people. And maybe some staff are working for some member of Congress will see that and say, hey, this doctor wrote this. They have credibility, stats, stories. Let's work on this. So that's how you can spread your influence and have greater impact. Now I'll tell you a little bit about like what matters to me. This picture is from the year or two ago. Doctors for America, we went out to the White House for a gun violence prevention event. That's where I got reconnected with SAFE at that time as well. Several members were there for that. And we were out there talking about with the work that had been done at the federal level for gun violence. A lot has happened in the past few years, right? We passed the Bipartisan Safer Communities Act. The next year, they created the White House Office of Gun Violence Prevention. The year after that, Surgeon General put out his report about gun violence being a public health crisis. And now all that's suddenly swinging back the other direction, right? Rapidly. So that's why it's more important for us to do our work. And for me, it's about gun violence and how that intersects with racial justice. This map here is a map of Atlanta from 1939. I did my trauma fellowship in Atlanta at Grady Hospital. And there has been generational connection between policies, federal policy made generations ago that still continue to reverberate today when it comes to community gun violence, which is my primary focus. And recognizing that policy and healthcare and gun violence intersect with a lot of other social determinants. And back then, they used to have what's called red line maps. You can see the red areas here, where the federal government would say, these areas are a bad investment. So if you wanted to buy a house, you could not get a loan to buy houses. And as you can imagine, those areas that were designated for risk by the government became businesses divested, housing prices tumbled, education, healthcare, but also an increase in gun violence. And even though this map was made in 1930, when I was a resident or fellow in 2010, the majority of my gun violence victims came from those red areas. So it's been durable over time. So if policy can create these situations where our patients are suffering, it is up to policy to reverse that. And it is up to us with our stories and our statistics to continue to advocate at all levels of government to make that happen. And I will say this, students, you don't have to wait till you're a doctor to make a difference. I tell you, once you get in medical school, you have so much credibility. Because I'm certain many of you, the day you got into medical school, people were asking you for medical advice. It happened to me. That's kind of the par for the course. So use that experience and credibility to make a difference. Thank you for listening to me. I hope some of this is helpful, and hopefully you can put some of this to action today. This is a QR code for LinkedIn. Please stay in touch with me and connect with me. I am looking to partner with anybody and expand this network because it's going to take all of us working from different angles to ensure that we can create a nation that is safe for us and future generations from this epidemic of gun violence. Thank you.
Thank you, Dr. Williams. So if anyone has any questions for Dr. Williams, please put them in the chat and then we'll address them during the Q&A at the end. I'd like to now invite Sean Holihan, the State Legislative Director of Giffords, to speak. He'll be discussing how we'll be applying this to building relationships with legislative aides when we try to educate our elected officials as healthcare providers. Sean, the floor is yours.
Great, thanks so much. And thanks, Dr. Williams. I wish I could have you speak to every single coalition of people across this country. It's a hard act to follow. So a little bit about me. Sean Holihan, I work at Giffords, been here for about 4 years now. I've been working in the realm of state legislative politics and policy for over 15 years at this point. And I thought this being asked to talk about legislative aids was kind of apt because for 5 years in the Virginia General Assembly, I was the chief of staff to members of that legislature. So it almost felt like very much two sides of the same coin. You know, Dr. Williams was talking a lot about the best ways to advocate and why your voice is so important. And I felt like I was a legislative staffer being like, yes, more of this. Like, yeah, bring the one pager, sure, but like, tell me your story. So it was like very refreshing to hear that. So first and foremost, I think it's important to understand the difference between state and federal, first of all. So a lot of this talk is about Wisconsin, and the main difference is that the number of constituents that a member represents. So in a state like Wisconsin or Illinois, your number of constituents might be around 50 to 60 to 100,000 people. In Congress, it's many, many more, and you get a lot more staff. Wisconsin is a little bit lucky because you actually have legislative staff to help you talk to constituents and help you move policy. In some states like Georgia or Delaware, you have no staff. There's no one helping you. You're on your own completely. So the voices of experts become even more respected and needed. Places like Georgia, there's might be one scheduler for every 3 members of the House. So members are really out there on their own. Before I worked in gun safety, I worked in the sexual violence prevention field. And I was working with a member there, and I had to do everything for this guy. He was a trial attorney, so he was busy on his own. And we were working on sexual assault nurse examiner legislation, something where we did bring medical experts in to tell their story and why this was so necessary in a state like Georgia. And I had to do all the comms for him, all the legislative research, everything, because they just had no staff. So while Wisconsin does have staff, they're stretched thin. Not everyone is going to be, a champion on gun safety. They're going to be worried about transportation, on healthcare. They're going to be worried about, the environment and so you find a few people who are going to be experts and the loudest voices in the room. But if your member, the person who represents you, is not that, they're going to rely upon you for a lot of that work. So that's a little bit of the difference between state and federal. Federal, it's a little bit harder to form a relationship. But the state, it's so much easier because you're there. They have to do a lot of these teas and coffees and events. If you want to show up to your members' public event, it's very easy for you to have a relationship with that person. So point 3, what lawmakers value in advocates? Really, Dr. Williams covered a lot of this. It's your credibility. When we talk about validators, when it comes to gun safety, number one, we're talking about police officers. Those are always the most trusted voices when we talk about gun safety. And then right under that are medical professionals. These are people who are trusted by any audience. You walk into a room, they are seen as nonpartisan. They are trusted partners in the community. So your voices are incredibly valuable to this movement. And coming in, as Dr. Williams said, with a story about how this affects your community, what you've seen yourself, why this is needed. When we work on community violence intervention funding across this country, especially when it comes towards hospital-based violence intervention funding, I would not be able to pass legislation in states like we have without medical professionals coming in with me, especially when they're constituents. So that's another thing to consider here. We feel like we have to respond to every single push to message the president, the Speaker of the House, the Senate Majority Leader. Your messages, by and large, will go into a giant folder and they might be counted, but they will most likely be ignored. The people who you have to work with and develop a relationship with are your members, your state senator, your House rep, your member of Congress. So concentrate on that. Even if they're not friendly, they will hopefully be able to have a good conversation with you and see your side of things, why gun safety is so important to their community. So this is going to be a very long fight. And we have a lot of folks who consider themselves to be Second Amendment advocates. But we're seeing progress. As Dr. Williams said, there's a lot of progress that's being held, and we need folks like you to continue to tell your representatives why it's important to safely store a gun. This is an 80% issue. We should be able to get everyone on board on this. All right, moving forward to how to build relationships. I touched a little bit on doing things in district. So it's not so important to show up to, lobby days, although I'm going to be in Wisconsin for a lobby day, and I'd like to +1 what WAVE is doing, because that does allow everyone to come in, and it's very impressive to see everyone showing up at the same time. But this is done over time. Like, you can't just show up and suddenly you're besties with your state senator and their staff. You have to continue showing up to their in-district events. That is where you really form the best relationships. And the reason that you want to do that is so you can be seen as a resource. We touched upon earlier that they have sometimes no staff. If they have staff, they might have 1 or 2 people who are working on their communications, their policy efforts. But if you are able to be seen as a respected source for a chief of staff or a legislative director, they will always look to you for advice, for research. And that's when you really have developed a relationship with your member of the legislature, because you're helping that policy person. They don't know what medical guide to look at. They don't know what research is trusted if they pull it up, or if they include it in one of their op-eds. They want to know that if they're going to the press with some research, it's going to be respected and it's not going to be laughed out of the room. Chances are, if you have a relationship with that legislative staff, they're going to ask you and say, hey, is this what we should be using, or is there something else we can take a look at? So, and again, personal stories are very important. When I have done community violence work, gun safety work, constituents who have a story to tell is the most powerful weapon you have when you're moving someone. When I passed legislation in Wisconsin many moons ago, when I was working in the sexual violence field, we had a victim of sexual violence who was brave enough to tell her story to a member of appropriations committee, who didn't see allocating funding towards internet crimes against children task forces as a main priority. Everyone's coming hat in hand for funding when it comes to the budget, everyone. And no state is just willy-nilly giving out money. You always have to make your case. And so it was a 2-year effort. The first year we came, they saw it as something that was needed, but not necessarily right now. And then we brought a victim, a constituent. And by the end of that meeting, the senator was moved to tears, and he became our champion for not just that session, but for years afterwards. So telling your story is incredibly important, and it just shows why you were so connected to the issue and why they should be too. Stats are good, but stories are more important. So one thing we've touched upon a little bit is tone. It's always important to be respectful. Some of these people we deal with can be tough folks to have a conversation with. I just got yelled at by 3 Pennsylvania House members a few weeks ago. That was a fun meeting. They didn't like that we didn't endorse them in their last race, despite being Republicans in tough districts. And they felt like they wanted to vent to me. And I had to sit there and I had to take it and just say, we appreciate where you're coming from, and we hope to still be able to work with you. These folks are going to be here for a long time, whether they be staff or whether they be legislators. Some of these people are around for 5, 7, 10 years. And if you are going to send a terse email or tweet something nasty about them, they remember it. They've got long memories. And then you're no longer welcome in that office. So this work can be really difficult. And I know as advocates, you're doing this in your free time, and you want to be treated as you would treat others. But sometimes, you have to turn the other cheek and, remember that this is a relationship you want to be able to build on long term. I think it's mostly it for me. I think just the major takeaways when you're thinking about legislative staff, and a lot of this covers both legislators and legislative staff, is that you want to be seen as a tool to use for the legislative office. A congressman's office has a million different tools they can use. They have a legislative director, a full policy team. They have numbers of people who have different portfolios they work on, and one person is directed to work on gun safety, and as well as a bunch of different things. In state legislative offices, you might have one person who's working on policy, if that. So if you're able to form a relationship, you get to be that person who works on gun safety policy. And that is really the aim here. With, your credentials, your connections to the community, your ability to tell a story and why this is so impactful to you and why it should be to your representative, I can't compete with that. As a paid person who's worked in this field for 15 years, I literally can't compete with one of you walking into your member's office and telling the story. So just remember that. And if you ever need a little bit of help trying to work your way in, give me and Nick a call, and we'll be happy to help you.
Thank you so much, Sean. That was really great to hear. And SAFE really values the partnership that we've built with Giffords, and we're really grateful you were able to share with us today some of your stuff you've learned. So now we're going to shift to hear from Nick, who is a part of WAVE, which is the Wisconsin Anti-Violence Effort. And we're going to hear him talk about state-specific work, as well as how those of you who aren't in Wisconsin can start to think about participating in similar events in your own state. So I'll pass it off to Nick.
Alrighty, thank you everyone. Thank you for being here. It's good to see so many names in the chat that I recognize and have worked with over the years, so thank you all for attending. My name is Nick Matuszewski. I am the Associate Executive Director with WAVE Educational Fund. We are the primary state-based group that does gun violence prevention in Wisconsin. So we partner with national groups like Giffords, Brady, and others, and we've been partnering very closely with SAFE lately, which has been amazing. But we kind of help to coordinate some of the efforts in the state around this issue and ensure that we're all kind of working at this from the same angle. We know that groups are going to have certainly going to have different priorities and things like that, but we'd like to ensure that we're at least kind of communicating what we're working on and what that looks like. So I'm going to spend just a little bit of time today talking about our upcoming Day of Action. This is not just a WAVE event, this is a coalition-wide event, but I'm happy to kind of walk through what that's going to look like if you are able to participate, what you can expect, and then even, hopefully provide some tips or ideas for what folks should be doing if you want to have a similar Day of Action in your state, or even maybe at the local level, a city council Day of Action or anything like that. So, this can be adaptable to any level of policy makers, and hopefully it can be helpful for everyone here. So before I talk about the Day of Action, which of course is kind of the main thing I'm going to be highlighting and previewing here, I do want to talk a little bit about the Wisconsin Gun Violence Prevention Coalition, which I'm really honored to lead. It includes partners from across the country and in Wisconsin who are working at the state level in Wisconsin. The coalition has been around for about 2 years now, but we're really sort of kind of making it more official at this point. We're working to create branding and stuff of that nature. And why that's important, I think, is that for a long time, legislators in the state, even some of our allies, would kind of register a lot of frustration over the fact that there were all these disparate groups who were working on gun violence prevention and doing great work as individual organizations, but not always approaching things from the same perspective, or perhaps prioritizing bills in favor of one bill, and then another group was in favor of a different one. And the champions in the state who are doing this really great work in our legislature, we're looking for kind of a guidance on what should be the top priorities and ensuring that all the groups are working as closely together as possible. So that's why we went ahead and with our close partners created the Wisconsin Gun Violence Prevention Coalition. Many of the folks in this call are already part of the coalition. Sean and Giffords are amazing partners, and I just want to call it out up front too that they are really generous and are supporting our Day of Action, and we really appreciate that. We think it's super important to have this coalition structure in the state for all the reasons I said, but also just because it's, from what we've heard from folks in the legislature, it really is putting a bit of a fright into the gun lobby in the state, into legislators who have always kind of done the bidding of the gun lobby with very little pushback. I also want to point out that the coalition has expanded in recent months. We've created a youth wing of the coalition. So if you know anybody that's aged 15 to 24 and wants to join that, we actually have a meeting tonight. I'll put my information in the chat once I finish speaking. So if you want to join or you know somebody that would like to join, just let me know. And then we've also created, as Allison mentioned, a healthcare committee or coalition within the broader Wisconsin Gun Violence Prevention Coalition. Kelly Snooks, who's on this call, is helping to lead that. And we are really excited about the work that they've already done. All right, so with all that background, I will get into our day of action now. Day of action is going to be on Tuesday, May 20th. It's going to be at the Capitol, but we are first meeting at a church right outside the Capitol at Bethel Lutheran Church. It's a short walk from the Capitol building itself. The day is going to be focused around a set of priorities that the coalition has already laid forward as our top priorities for this session. So to quickly walk through those, and I'm happy to go out into more detail if anyone has questions or wants to stay on or talk one-on-one at another point. But the coalition's top priorities for this session are universal background checks. So ensuring that every single gun sale that occurs in the state has to have a background check, regardless if it's amongst private sellers, online, at gun shows, anything like that. So that's a very foundational policy that we're missing here in Wisconsin. We know that it would be incredibly important to save lives. We're also pushing for an extreme risk protection order, which is or an extreme risk law, which would create an extreme risk protection order, rather, also known as red flag laws. Essentially, this would be a policy that would allow for family members, law enforcement, sometimes healthcare providers, and other folks who work in that field to go to courts, initiate a civil procedure to potentially remove firearms from somebody who is deemed to be an imminent threat to themselves or others. We know this is a really, really strong policy for reducing suicides. And it's something that 20-some states have already implemented, and it's something we think that we can get some support for here as well. We're also going to be pushing for funding for community violence intervention programs, also known as CVI. These are programs that work with individuals and communities who are, community leaders who are trained to go on and mentor individuals, mediate conflict, ensure that folks who might be heading towards, a path of violence or, anything of that situation are given resources to break out of that cycle and are allowed to pursue a different path. So that those programs are really, really important, and we're going to try to push for that in the state budget. We are also working to create a domestic violence misdemeanor, which would ensure that anybody who's convicted of a domestic violence crime in the state has their firearm removed. For decades in Wisconsin, we were working under a system where folks would be charged with something other than a domestic violence misdemeanor because we didn't have that charge here, and their firearms were removed if the fact pattern involved domestic violence in any way. Our courts just a couple of years ago ruled that because we don't actually have a domestic violence misdemeanor law, any of these other charges don't quite meet the federal prohibition on domestic violence perpetrators being not able to have firearm or purchase one going forward. So we're going to try to remedy that and create a new domestic violence misdemeanor policy. And then we're also going to try to amend our child access prevention policy in the state. Currently, the policy is stated that anybody under the age of 14 is deemed a child. We want to raise that to 18. I think that makes a lot of sense. And we want to ensure that parents of children or anyone who's in the home with the children is required to store their firearm, and the penalties for not storing their firearms can come into play even if the child does not gain access to the firearm, but just if they could gain access to the firearm. We know that parents and others will always say, my child wouldn't use this firearm to harm themselves or others. So I don't have to worry about making sure that my firearm is secured safely. The truth is that parents need to have that incentive to store their firearm, regardless of whether or not they think their child would ever use it, because usually parents don't know and are often sadly surprised by what happens. So those are kind of the top priorities that we're pushing for on the day. To kind of walk through what the day is going to look like, we will meet at Bethel Lutheran Church around 10 a.m. That's when we'll get started with our programming. We will hear from policy experts from our partner organizations on the different priorities that I just laid out very briefly, go into a little bit more detail on what those are and what you should be telling your legislators. We'll hear from some legislators and staffers on best practices for communicating with legislators. We'll hear from some keynote speakers. We'll have lunch, and then we'll head over to the Capitol for a group photo and a press conference that will, amongst other things, kind of officially introduce the coalition. And, as I said, we've been around for a few years, but we're kind of making things official and formalizing it in that sense. So after the press conference, all attendees will have a chance to meet with all of their legislators, so their senator and their representative. And then we'll probably have some offices that don't have any members there. So, you might have a chance to meet with a couple other offices as well, or at least drop off materials there. We think it's really important that we try to have contact with every single legislative office or their staffers, especially in this session and in this political environment. We know that with our new maps, there are a lot of offices that in the past haven't really had to worry about this issue. And now they know that their constituents care very deeply about it. And if they want to get reelected, they have to listen to the concerns of their constituents. So this is going to be a really important day of action for us. We are doing a follow-up day of action with Moms Demand Action kind of taking the lead on October 21st. And that event's going to be more kind of limited in who we meet with. It's going to be a little bit more strategic based on where bills are and who has been holding out on voting for them. So I'm obviously going through this very quickly, but that's kind of the run of show for the day. We are going to be providing transportation for folks who want to come in from Milwaukee or any of the surrounding Milwaukee suburbs. It's free of charge. Folks are able to provide a donation if you'd wish, but if you can't afford it, we can make it free of charge for anybody that wants to join. So let me just walk through a little bit about best practices for running a day of action in case you want to do something similar in your states. So we think it's really, really important to build your day around clear policy asks. So making sure that you have a list of policies that you're pushing for. Usually you're going to want to have one-pagers and other documents for your supporters to read through and familiarize themselves with. You'll want to do a presentation where you walk through each of the policies to ensure that when they meet with their legislators, they are as educated as possible on what they're talking about. You want to uplift community voices, and in this work, you always want to uplift survivors' voices as well, if survivors are willing and comfortable telling their stories. I can say, for instance, we had a meeting with a legislator just a couple weeks ago, and one of their constituents was a survivor of gun violence. And at the end of this meeting, this legislator, who is a Republican, who has typically stayed away from this issue or been more in line with the gun lobby, has come out and said that they want to support one of our policies. So these voices are very important. I'll also say to that note too, since I know a lot of folks on this call are healthcare workers, that another Republican has actually authored one of the bills that we've been pushing for over the last 2 sessions. And the reason he gave when we met with him for why he authored it is that he said that he has a lot of healthcare workers in his district, and he met with some, and they asked him to take this issue seriously. And now he's kind of finding different ways to support the policies that we are pushing for. So that just kind of goes to what Sean was saying about you all having a very powerful and important voice in this movement. Other best practices to consider, of course, you want to have really great partners. If you do have a coalition in your state, tap into that. If you don't, consider forming one, and I am very happy to help with forming coalitions and what that could look like and who should be invited, or connecting you with the coalition that might already exist in your state. With your partners, you can help get help with logistics, transportation, any sort of way to reduce participation barriers to make it cheaper for folks. Make sure your materials are branded, concise, and if you have the capacity, especially if you're only meeting with a few legislators, try to personalize your materials for individual legislators as best as you can. Make sure you kind of read about their background, which organizations they're aligned with, and try to find where you might be able to tap into their stated interests. I think that's kind of the long and short of it. We're really excited for the day of action. I'm going to put in the chat some links to sign up for the day of action, which I think has already been shared, but just to re-up that, other ways that you can help out with the day of action if you're interested in doing so. Another link for just joining WAVE's advocacy efforts in general. And then I'll also include my email if anyone has any follow-up questions. But thank you all, and I will pass it back to Erin.
Thanks so much, Nick. So after hearing from all of our speakers, Allison is just going to kind of give a formal wrap up and then begin the Q&A.
Thank you. Hi, everybody. I'm Allison Volkman. I'm the executive director at SAFE. And our three co-hosts are all off to their next lecture or their next class. So I have the honor of being with you today to sort of finish up our time together and tee up some Q's and some A's from things that have come through privately on the chat. First, let me share that our fourth session in this 6-part series on secure storage advocacy and policies is going to be held sometime in July. It's going to be an education and feedback, excuse me, on letters to the legislators. We're going to have a discussion about follow-up responses from those letters that we're going to be sending, and then from the letters and the calls on the day of action at the Capitol. Education research on Wisconsin legislators who are likely to be supportive and how to engage them, and we'll give you some tools on how to look up your own legislators in your own states if you're not here from Wisconsin. So now we're going to shift a little bit into some Q&A. If you have questions that you would like to be asked, please feel free to either send them privately to me in the chat or publicly is fine. And I will be asking Dr. Williams, Sean, and Nick to get to as many of them as possible in the next 10 minutes or so. So the first question that I'll ask that came from someone, it says, do lawmakers meet with constituents to hear about concerns or issues outside of advocacy days? Is it as easy as writing an email to introduce myself and that I'm a healthcare resource to them? So I'll ask one of our speakers to try to answer that question.
I'll take that. I'll say absolutely yes. And I think it's really important to make that outreach outside of advocacy day as well. And emails are a great way to do that. Phone calls. I will say from my experience in the office I worked in, we weekly went through all the phone calls that came to the office and all the emails and said, we had 25 phone calls about gun safety, 30 phone calls about X, Y, and Z from constituents in the district. And the thing about Advocacy Day, it's a great photo opportunity. A lot of people come in, you're coming in mass, it looks great. But what I've seen a lot is people get their photos, they post on social media, and then you never hear from them again, right? You have to follow up with the offices that you visit. And I just want to echo what Sean said. A relationship with one of the staffers is key, because they may be a ledge aide today, but a couple years on the road, they'll be a senior advisor. They may become the chief of staff. So you are playing the long game. You're looking at something that's going to be 10, 20, 25 years. So someone you meet today can be an ally for you many, many years down the road. So beyond Advocacy Day, the phone calls, the emails, even if they don't respond, I would say that most offices are tracking that. And we know who are the repeat offenders. So yes, continue that sort of outreach.
Great.
I want to add to that really quickly and say that one thing that's always interesting working at state level politics and with legislators and others. Sean, I'm sure you can add to this too, but I think folks think that, well, if I just call the office or if I send a letter to the office, it's just going to get lost in this big pile of a million different things. And to some extent that can sometimes be true, but we've found that oftentimes when we'll try to get folks to call in their office and the office gets like 4 or 5 calls on an issue, they're reaching out to us like, hey, slow down the pressure. Like, that's too much. Like, it's almost comical, but I think really at the state level, they're not getting as much outreach that you would see at like the federal level or whatever. So even, one phone call or getting a couple friends to call is going to do more work than you might expect. I don't know, Sean, if you sent in other states too, but that's how it is in Wisconsin.
Yeah, no, I mean, there was something a legislator told me a long time ago. It was if they got 5 individual messages about the same topic, it basically shut the entire office down and they would have to respond. So we're not talking about like a form, like a click through. We're talking about an email or a phone call from a constituent with saying like, hey, I really think you should support this bill. Whether it be safe storage or ERPO or what have you, it really does cut through. There's a lot of form stuff that go around that people just easily click on and don't really follow up through. And so I have a ton of stories of legislative offices following up with someone who has signed one of these click through, like just add your name. And oftentimes they don't even remember putting their name on it. And they're like, why are you calling me? How'd you get my contact information? Like, well, you sent in this form. So the individualized contact really does work. And, as Dr. Williams said, I think coming to a lobby day is incredibly important to show the strength of the movement. But after that, it's about putting in the work to show up to those district events. Every legislator has these like coffees or whatever, they might have a picnic or something that you can show up at and respectfully give your opinion. So I think it's very important to continue doing that in district level work.
Thank you. Another question, while gun violence affects all patients in some way, how can physicians that don't directly treat patients most affected by this epidemic still be effective storytellers and share compelling anecdotes?
I guess that's a question for me.
Yeah, I think it is.
We hear when it comes to gun violence, I would say emergency medicine physicians and trauma surgeons are probably the most vocal voices out there talking about this issue. But the truth is that no matter what your special, pediatricians, don't forget pediatricians, no matter your specialty, a victim of gun violence is probably going to pass through your office at some point. So those stories are important. For example, a woman that is suffering from intimate partner violence will be seen multiple times by her PCP or her OB-GYN. And they may be seen multiple times throughout this abusive relationship before there is an act of gun violence perpetrated against her. So I would say that it's not just specific specialties that are seeing these patients before and after. And like I said, I should even mention post-injury wraparound services such as psychiatry, psychology. You have stories about what leads up to these incidents and how patients are responding afterwards. It's not just about that moment where they are shot in the ED, near death, and people are trying to save their lives. So never dismiss the importance of your ability to tell these same kinds of stories.
Thank you. We have a question or request from Dr. Kelly Snooks. She's thanking you for your advocacy, and as someone who's going to be doing an NAM State Health Policy Fellowship next year, she's wondering if you could talk about the pros and cons of that time away from clinical medicine and gun violence prevention advocacy for that experience. Thank you.
Yeah, so I did a Robert Wood Johnson Foundation Health Policy Fellowship, which was supported by the National Academy of Medicine, and mine was a federal level congressional fellowship, which was full-time. So I had to leave clinical practice and move to DC for that year. I'm not sure how the state level fellowship works, but to answer your question, it was the most transformative experience I've had, and I would not give it up for anything. True. Had to take a cut in pay. For a year, I was not operating it or teaching residents and students. So parts of my professional life that I really enjoyed, I had to set that aside. But that was a choice I made to be able to take my experience and expertise into an arena where I felt it could provide more value. And it was a bi-directional benefit. I was able to provide frontline experience to them, and they taught me the process of getting legislation done, what it means to have an idea, write it out, go to Ledge Council, get it in a bill, walk it through committee. All of that was something I had no idea about until I did this fellowship. And now I can take that back and share it with other people so that they can become more effective advocates. So if you have any question about doing it, I would say don't even think twice. It will be a transformative and very meaningful experience.
Wonderful. As another question is, as future healthcare professionals, how can we balance sharing personal patient stories for advocacy with protecting patient confidentiality, especially when addressing emotionally charged topics like firearm injury prevention?
I'll tell them in two parts. You're never sharing specific names of patients or anything that can help identify whom they are. And the sad reality is that gun violence is so prevalent in this country that you can talk about specific issues, and there's probably many people around the country that can identify with that particular gun violence incident. But I'll say beyond that, even more important, if you can partner with a survivor of gun violence who's willing to join you in telling the stories, that enhances the power of what you are trying to say. So as a healthcare provider, you have credibility with the frontline experience, clearly telling me stories without identifying specific patients. However, if a survivor wants to come with you, that will even add more credibility and power to what you are trying to accomplish. And there are plenty of survivor networks out there that are eager to do just that.
Thank you. A question from Dr. Siobhan Wilson. She would value any insights that the speakers may have on financial donations to causes while acting as an advocate and/or healthcare provider. Aligned actions, but is it seen as alienating or otherwise negative in advocacy or community work or health work?
I don't think so. I think, not many people look up your donation, your contribution history when you're requesting a meeting for someone. I think where we get ourselves into a little bit of trouble is when we live in a district that is represented by someone who is potentially from a different party from us. Those are the hardest level conversations we have to have, because a lot of the issues around gun violence prevention are rooted in primary level politics, and it's very difficult for Republicans to vote the way that we want them to because of the political issues that are so involved there. So it's really just about making sure that all your conversations are respectful, and you're not seen on social media blasting them. It's different if you want to make a contribution to their opponent. I think that is something that's sort of accepted in American politics and discourse. It's different when you're, blasting them on Instagram or TikTok or something.
Yeah, I would second that. And also just say, in general, if you are trying to have meetings with your legislator and you're not getting responses, first of all, they're not doing a good job. But secondly, feel free, if you're in Wisconsin, to reach out to WAVE. We have pretty good access and can usually get meetings when sometimes individuals can't. If you're not in Illinois, groups like Giffords or the state-based group from whatever state you're in might be able to help you too. But we're really, happy to help out with trying to get people access to their legislators if they're not getting that already.
Wonderful. I have one more question to tee up. Thanks for everyone for sticking with us, and then Dr. Williams will close our event. Dr. Williams shared how he got into gun violence prevention advocacy work. And is it important for us as physician advocates to be able to share why we do this work? What if our own story doesn't seem distinguished or impressive enough? And what do we do to avoid imposter syndrome? Kind of a biggie. Brian, do you feel that you
Okay.
could address that?
Sure. You take this for what it means to you. I felt that being a doctor, working on the front lines of this gun violence epidemic, that was my form of advocacy, right? I was doing enough to contribute to reducing firearm related injuries and death in the community I served. However, recognizing that there's a connection between the work I do in the hospital and what policymakers are doing outside the hospital, I had to bridge that somehow, not knowing how to do it at the time, but I had to make a choice about to bridge that somehow. And for me, it was that event. It was really that year. That year, there was, it was a big year for racial justice. It was many shootings that year. So if you remember 2016, it was kind of a crescendo of violence and hateful rhetoric leading up to that presidential election. So when the shooting happened, it was within that cauldron where I had to decide, okay, what do I want to be going forward? Do I just want to be a doctor in the hospital, which would probably be enough? Or do I want to take that experience and bridge that with others who are doing this work that may not know what I'm seeing on the front lines? And that's when I started to become a more vocal advocate, primarily through writing, but also speaking to the media. And believe me, I'm someone who avoided the media at all costs. And now I'm talking to this, sharing these stories. And that was a choice I made. I will caution you, though, think about your employers and what that means when you're out there talking about a very controversial issue such as this. Despite the fact that it's about saving lives, we got to recognize that this is a charged issue, and your employers may have a different opinion about how you can be publicly speaking about this issue than you can. So there are many things to navigate.
I just want to add one piece. Everyone's story is different. Some people have a very interesting and compelling story, like Dr. Williams. I was mugged once in DC, right? Like that's not compelling. It's you're throwing a story out there. I come at this as someone who firmly believes in the mission, and so, and as many of us have talked about here today, it's not so much about like if your story is like very, very compelling or important. It's about mirroring and partnering with someone who has, as Dr. Williams said, you bring a constituent with you who has been a victim of gun violence. That is going to really move someone. But oftentimes compelling someone to talk about their trauma can be difficult. And so, I think it's important to care about this issue, even if it hasn't directly impacted you. But it can just be that. It can just be that you want your community to be safer, that you're tired of seeing people in inner cities be affected by daily gun violence, that you're tired of seeing public spaces and schools being shot up. I think that is okay. You don't have to have a story that will get picked up by the New York Times. And you can forgive yourself for that. I can. If I can, you can. Not everyone can be Dr. Williams.
I'll just follow up on that with two really quick points too. One is that with the issue of having imposter syndrome or thinking, oh, my legislator is not going to care, my story is important or whatever. Keep in mind, and maybe this helps, maybe it doesn't, but keep in mind that their job is literally to represent you, and their staffer's job is to listen to you. So your voice does matter to them. You're a constituent. It's going to matter, even if you don't have a story that's particularly compelling. And then secondly, to that same point, when you are talking to the legislator, do as best you can to focus what you're saying to their district, the district that you're in. So if you are in a more rural area, focus on maybe the impact of rural suicides, because that's a very, very serious issue. I wouldn't necessarily focus on urban violence if you're in a rural area, and vice versa. So I mean, your story isn't necessarily the only thing that's important. It's how you frame the issue and make it relevant to the legislator that you're speaking to.
Thank you. Well, thank you, everybody, for staying with us for this event. This has been tremendous, in my opinion. Thank you to Dr. Brian Williams and to Sean Holihan and to Nick Matuszewski. We really appreciate Giffords' partnership and our partnership with WAVE and all the work that people have been doing. This work is critical. Thank you to all of you for asking such great questions and for being here and ready to learn about this topic. And we look forward to staying in touch with you all from SAFE. Stay safe, everybody. Take care.